Okay, I think by my clock, it is now 9:30. So in the interest of time and we're going to get started. Good morning and a warm welcome to everyone joining us today. My name is Victoria Custodio, and on behalf of the Active Transportation Resource Center here in California, I'd like to thank you for tuning into the fourth and final installment of our webinar series, Perspectives 2021. This series was branded as a statement of the ATRC's intentions to feature the wide variety of people and disciplines that can influence active travel, safe routes to school, and mobility safety. Or more specifically, the individual people and communities that we aim to serve through our programs and investments. Next slide, please. Okay, as this slide indicates, our title today is Diverse Perspectives on Student Safety Needs, Considerations for Safe Routes to School Practitioners. We called out Safe Routes to School here as we are at the start of the 2021-2022 school year, and many students are back to walking and biking to school for in-school instruction after a prolonged period of remote learning. That all said, we do think this webinar will have appeal and insight to everyone from the Active Transportation Network, not exclusively Safe Routes to School providers. As our announcement read, safety is a top priority, if not the top priority, for many of us who work in the work that we do. Yet, as we are all aware, the term safety elicits different ideas and actions depending on who you're talking to. Today, we are taking a holistic view of student safety, and that includes emotional and physical safety, both at school and in the community. We have a tremendous guest panel today featuring the following list of speakers on the slide in front of us. I'm going to give each a proper introduction before their individual presentations, but for now, I just want to give a heartfelt thank you to our three speakers, Elena Costa, Janine Barbado, and Sarah O'Brien, for their willingness and graciousness to share their wisdom and good work with our network today. Next slide, please. Okay. Here are our learning objectives. We see our webinars as learning opportunities for our network, and our team always likes to offer up learning objectives for those in attendance. So as the screen reads, today's webinar will explore the theme of safety as it relates to the return of in-person instruction during COVID-19. Yes, we are still in the pandemic. We're going to learn about trauma, the how and why of trauma-informed approaches, and how they are good, how they're useful in developing student-focused programming. We're going to gain an understanding of California's Safe Schools Hub, which is an interactive website on all things COVID, and also speaks a little bit to the state's ongoing efforts to address reducing COVID transmission as schools return to in-person instruction. And then lastly, we're going to identify strategies for how law enforcement organizations can support pedestrian and bicyclist safety in collaboration with other safe routes to school and active transportation partners. Next slide, please. All right. Okay, I know you're all intrigued and ready to begin with the official webinar content, but I just need to go through a few webinar logistics very quickly. We ask that everyone who's not speaking stay in listen-only mode to minimize background noise. We'd like for you to share any questions or comments that you do have in our chat, and to send those comments to everyone. Please don't just focus on the panelists. I think the questions serve as a way to engage everyone in the interactiveness of this webinar. And please note that I'll be managing a more robust question and answer session following all three panelists. And then just two other items. Please, we ask that you complete the post-webinar survey following the end of the webinar. That's going to be an Alchemer survey and just helps us gauge what your takeaways are from attending this webinar today. And lastly, we always get this question. This webinar will be recorded and posted to the Active Transportation Resource website, and the address is in blue there. Next slide, please. Okay, and here's a visual for those of you who like visuals, just on how to share your comments and questions if you haven't attended a webinar of ours on the WebEx system. The chat feature, you see the blue circle with the text, the voice box, that is the chat feature. You want to click on that, and then you can type in your question. Make sure you hit return to get that question sent out to the group. And then when we get to the Q&A, you know, and I'll manage this, but if we have the ability to allow our attendees, you know, to speak their questions, to verbally ask their questions, there is a raised hand feature which you can find if you take your mouse and hover over your name in the participant list. So you need to click on the participant list and then find your name. And then you can see there's a way you should be able to have a raised hand feature. And I'm doing it for myself and not quite finding that there. So definitely use the chat, and then we'll see if we can engage with the hand feature. Okay, next slide, please. All right, and just a shout out to the Caltrans team who manages the Active Transportation Program, Emily Abrahams and Summer Lopez. Without their leadership and foresight and support, this webinar would not be possible. And last but not least, shout out to my colleagues, Marianne Hernandez and Judy Polikoff, who are my colleagues. Together, we make up the Active Transportation Resource Center's non-infrastructure team that's based at the California Department of Public Health. Next slide, please. Okay, so we're going to get set up with our next speaker, but before we begin, we would like to hear from you in our chat. So if you could answer the following questions in the chat, and then Marianne, we can switch to the slides, but the questions read, are you currently engaged in a Safe Routes to School project or plan, or do you plan to begin one? And then the second one, just let us know if you're a Safe Routes to School provider, and if so, where in California are you attending this webinar from? So we'll get that chat going and move over to our first speaker. And I'm going to do a quick bio. So I'm very pleased to introduce Elena Costa, my friend and colleague. Elena Costa is a program coordinator for the Essentials for Childhood Initiative with the Injury and Violence Prevention Branch at the California Department of Public Health. Elena joined the Essentials for Childhood Initiative in April of 2019, seems so long ago, and supports a statewide coalition and its subcommittees to educate about where opportunities exist to help California children achieve safe, stable, nurturing relationships and environments. Excuse me. She also is central to many efforts to create policy change and activities that prevent and reduce childhood adversity. So Elena, if you can take yourself, put yourself off mute and give me the verbal okay that you're there.
I'm here. Good morning.
I'm so comforted by that. All right, take it away, Elena. Thank you.
Oh, thanks, Victoria. Thanks for that warm introduction. It's so nice to be here with all of you. Happy Wednesday. I'm so excited for the opportunity to speak to you more about trauma-informed approaches and practices, and where there are, opportunities and considerations to approach and enhance student safety and build resiliency. Next slide, please. Okay, so this morning my goals are to be supportive about a very high-level overview as to what it means to be trauma-informed, to share some principles of what a trauma-informed organization looks like, and to maybe have some discussion about where there might be opportunities for the Essentials for Childhood Initiative to be supportive of your efforts to adopt and implement trauma-informed practices and approaches in your youth engagement work. Next slide, please. So just really quickly, just a bit about the Essentials for Childhood initiative. In front of you is the mission and vision, but essentially Essentials is a CDC-funded project that is in our second 5-year cycle of funding. The Essentials for Childhood initiative is a coalition comprised of about 80 different organizations and programs that are all seeking to find opportunities to improve the lives of children and families and to support safe, stable, nurturing relationships and environments, as Victoria shared. And next slide, that's totally fine, thank you. The Essentials for Childhood initiative seeks to address child maltreatment and adverse childhood experiences, or ACEs, as public health issues. The project is working to raise awareness and commitment to promoting safe, stable, nurturing relationships and environments. It seeks to create the context for healthy children and families through social norm change, programs, and policies, and utilizes data to inform action. And there are about 4 subcommittees that are working all the time to take on projects and efforts and be supportive of statewide focus areas to improve the lives of children through their existing work. So we're so excited for the opportunity to collaborate with Active Transportation. All right, next slide. All right, so I'm just going to do a little bit of background on what ACEs are. So ACEs describes, the term ACEs describes all types of abuse, neglect, and other potentially traumatic experiences that occur to people under the age of 18. ACEs have been linked to risky health behaviors, chronic health conditions, and early death. And we know that as the number of ACEs increases, so does the risk for these outcomes. But it doesn't necessarily mean that a child with ACEs will experience poor outcomes. There are lots of protective factors that can protect against negative health and life outcomes even after adversity has occurred. Next slide, please. So how did we understand what is an adverse childhood experience, or an ACE or not? Well, the leader in this area was Kaiser Permanente. They did a study. It was one of the largest investigations of childhood abuse and neglect and household challenges and later life health and well-being. It was originally conducted from 1995 to 1997, and there was 2 waves of data collection, and over 17,000 members from Southern California received physical exams that were completed and confidential surveys regarding their childhood experiences and current health status and behaviors. And the ACE study uncovered that ACEs are strongly related to the development of risk factors for disease and well-being throughout the life course. Next slide. So if you're curious about what the original 10 ACEs questions are, you can see them in front of you, but they centered on 3 categories, one being abuse, household challenges, and neglect. Next slide, please. All right. So this slide just shares about the pair of ACEs. So the leaves of this tree represent the things that we can see, the ACE that we see. And so those are things like physical and emotional neglect, divorce, incarceration. But what we don't see oftentimes, or aren't as apparent, are the roots, or what falls underneath the tree. And those are adverse community experiences, the things that lead to an ACE. And those include things like violence, poor housing quality and affordability, lack of opportunity, economic mobility and social capital, poverty, discrimination, community disruption. And these adverse community experiences are what link us to being able to find common ground, oftentimes with with lots of different programs, including Active Transportation, because we're seeking all together to address the community environment. Next slide, please. All right, and so just really quickly for some level setting, I just have 2 terms. One is trauma and the other is resiliency. So what is trauma? Trauma is the possible outcome of exposure to adversity that occurs when a person perceives an event or a set of circumstances as extremely frightening, harmful, or threatening. And as the result of trauma, a person can experience toxic stress, which is what happens when an individual experiences adversity that is extreme, long-lasting, and severe without adequate support, and the stress response systems become overactivated. Resiliency is the ability to achieve a good outcome in the face of significant hardship or adversity. It's built over time. It's not necessarily a trait. It is the interaction between the protective factors in the social environment and the responsive biological systems. The combination of supportive relationships, adaptive skill building, and positive experiences are the foundation of resilience. You know, trauma-informed, resilient-oriented healing center approaches means that we're changing our questions from what is wrong with you to what happened to you and what is strong with you. And, you know, I really like, there's a leader in this field, her name is Karen Johnson, and she has reminded us that in asking who are you, what is right with you, and what is right with your community, that we can consider where there are opportunities to be resilient-oriented and healing-centered in our approaches to our work. Next slide, please. For SAMSA, or the Substance Abuse and Mental Health Services Administration, there is a definition that they provide to us about what indeed trauma-informed really means. So for SAMSA, they call out the 4 R's, which are these bolded terms on the slide. And that is a program, organization, or system that is trauma-informed realizes the widespread impact of trauma and understands the potential pathway for recovery, recognizes the signs and symptoms in clients, families, and staff, and others involved with the system, and responds by fully integrating knowledge about trauma into policies, procedures, practices, and seeks actively to resist re-traumatization. Next slide. Okay, and SAMSA also shares with us 6 principles of what a trauma-informed approach is. And they are safety, trustworthiness and transparency, peer support, collaboration, mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. So safety really means where we have opportunities to create psychological safety, model vulnerability, model regulation. Transparency are the things that we do to share control with the folks that we serve, to share information, to use motivational interviewing. Peer support means these are the things that we do to promote relational health, to promote mental health awareness, and to be advocates. Collaboration and mutuality are the efforts that we take to level power differentials, communicate often in multiple ways, work together to consider solutions. Empowerment, voice, and choice are our efforts to focus on positive assets, seek input, ensure engagement of stakeholder voices. And cultural, historical, and gender issues are our efforts to support critical conversations, to be aware of implicit bias, to be curious about the impact of our work for all people, and be curious about where we can support healing for all people. Next slide, please. So SAMSA also shares with us and provides support around strategies that help an organization or an effort or program to be trauma-informed. And there are some examples here for you, but it's primarily that folks are supporting and investing efforts in trauma-informed practices and approaches, that there are written policies and protocols that establish trauma-informed approaches within the organization or the program's mission, that the physical environment promotes a sense of safety and collaboration, and that people who are in recovery, trauma survivors, people receiving services, and family members receiving services have significant involvement, voice, and choice in all areas of the program or organization's functioning. But there's collaboration across sectors that is built on understanding of trauma and the principles of a trauma-informed approach, and that practitioners use and are trained in interventions based on the best available evidence and science, that they're culturally responsive, and that they reflect the principles of a trauma-informed approach. Next slide. Additionally, what this could look like is where there's training and workforce development on the concept of trauma, and peer support is integrated into the normal practices of a program or an organization. Sometimes this looks like assessment or tracking and monitoring of trauma-informed principles and effective use of evidence-based screening, assessments, or treatment. This also can be resources to staff that are for training on trauma and key principles and making sure that facilities are safe, for example. And then, a really important cornerstone to trauma-informed work is to think about where there are opportunities to measure and evaluate our work. Next slide, please. So, one of the things that sometimes it can be a little bit hard to understand, like how, okay, so this all sounds good, but how do we apply that to maybe the work of active transportation? And, our friends in the Nutrition, Education, and Obesity Prevention branch shared with us that nutritionists don't necessarily or weren't always consistently thinking about trauma-informed approaches to nutrition as they worked as registered dietitians. And so one of the things that they shared that would be helpful is to create an infographic or a fact sheet about how best to apply trauma-informed practices and approaches to the work. And so in partnership, we created a piece called Trauma-Informed Nutrition. It's very tiny and it's in little terms, but I just pasted in chat a link to this document so you can see it and maybe be able to be a little bit more clear. And our interest as Essentials is that we are always working to be supportive of programs and projects that are interested in thinking about how they could apply a trauma-informed approach to their work. And so we are interested in asking, where there might be opportunities for the Essentials Project to assist you in your work as you think about where opportunities exist to incorporate trauma-informed practices and approaches. And so we're curious if we could lend support, like through any of the following ways. So we could be supportive with webinars from subject matter experts to talk more about trauma-informed practices and approaches. I just did a really high-level brief piece right now. We could create a short fact sheet or infographic that talks about applying trauma-informed approaches and practices to the work of active transportation in partnership with folks that might be interested in this, and certainly in partnership with active transportation team members. We could be supportive around briefs, and maybe, you aren't too sure, but you might want to keep talking about this topic, but sharing with us, do we have a poll, Judy? I'm not sure.
I do, and it should be up. People are starting to answer it, I think. It should be up.
Oh, yeah. Oh, I just.
So we'll give it just
now,
another minute.
Right.
Yeah.
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 Oh, very cool. So if you were interested, if you wouldn't mind terribly maybe checking one of these boxes for us, that would be a real gift and would help us to just kind of move forward with next steps. But if you have additional comments for us that maybe isn't a part of this A through D option, if you would put them in chat, we would really value the opportunity for learning and to be able to be most helpful to you.
I think we'll just give another few.
Okay. Yeah.
Here, hang on. Let me close the poll. I'm going to close the poll. Hang on.
Okay. Well, thank you so much for everyone that participated. And I will definitely look at your chat comments as well and follow up offline with the team, and we'll see what we can do to be helpers. Next slide. All right. So then I also just wanted to share a couple of resources. So we have a hyperlink to the Essentials for Childhood webpage in case you'd like more information about the work. We also put the link to the Trauma-Informed Nutrition fact sheet, but it's also in chat for you. If you're looking for data about childhood adversity, I recommend taking a look at Kids Data. They're our partners and provide super helpful information and work. There are some specific childhood adversity and well-being dashboards that you can find on PACES Connection. And then in partnership with Kids Data, we did a very special family experiences during COVID-19 questionnaire and oversampled California. And so there could be some data there that would be of interest to you. And there's a link. Next slide. And if you would like to get in touch with me and ask more questions, you know, here's my contact information. And I just really appreciated the opportunity for learning today and look forward to reviewing your responses and being a helper in the future. So thank you so much. Thanks to Active Transportation, Victoria and Judy and Marianne. And thank you so much.
Thank you, Elena. That was so wonderful. I feel like I have so many questions, which I hope to be able to ask you during our question and answer period, which we'll do after all the presentations. But really appreciate your work and sharing, you know, the potential for collaboration with our network. I really feel like there's a lot of opportunity to address shared risk and protective factors that will benefit, you know, our state on the whole, and just move us into a place where we can really live our healthiest and best lives, right? Okay, on that note, I'm going to shift over to our next speaker. Thank Elena. And our next speaker, I'm also pleased to say, is a colleague and friend. We're going to hear from Janine Barbado on Safe Routes to School for All, the School Hub overview. Janine Barbado has served on the school's COVID response team for the California Department of Public Health for 9 months, working as a team from the Governor's Office and the California Health and Human Services, with the goal of safely reopening schools in 2021. She has been with CDPH for the past 20 years, and for the past 6 years, she's worked in the Violence Prevention Unit, managing statewide programs on teen dating violence, domestic violence, and sexual violence prevention that are conducted at the local level across the state. Thank you, Janine, and just a quick audio check.
Yes, hi, thank you.
All right, take it away. Yes, you sound great. Take it away, Janine.
Thank you, Victoria. Thank you very much. Hi, everybody. Thank you for the introduction, Victoria. I'm so happy to be here. And as Victoria mentioned, I have been with CDPH for quite a while and with the Enduring Violence Prevention Branch for some time now. But like so many other public health professionals that work for Department of Public Health, when COVID happened, so many of us were redirected and taken off our current roles and put onto various other teams, as you can imagine. So I actually had a great opportunity to be a part of the school COVID response team in the starting in the late fall of last year. And one of the things the governor really wanted to push at the end of December, beginning of January, was reopening schools safely. And this was, as many of you know, a very, very contentious situation. And so many of us were affected by this, having children in schools. And it was a really difficult time. But thankfully, the science had really showed by the end of December that with the right safety mitigation measures, schools could reopen safely. And we really wanted to get, for the mental health of our students and the instruction, the importance of instruction, we really wanted schools to be able to reopen safely. So part of that endeavor was being able to create this Safe Schools for All School Hub website. And you'll see on the screen right there, and I believe it's in the chat as well. And this is a place, it's sort of like a one-stop shop for anything that has to do to learn more about how schools can open safely. Not only school administrators and teachers can go there, but also parents can go there as well. So if you please go to the next slide. And I'm not going to go over the whole page. You can go through that on your own, but I'm just going to point out some specific areas that may be more relevant for all of you here today. I understand that many of you have programs for students on school campuses a lot of times. And so one thing to note that when there are any organizations or groups or programs that are on school campuses, in other words, it's not run by the school, but you have you're using the school environment, they must follow the K12 school guidance. So it's really important to understand that. And so on this page here that you'll see, if you go to California's K12 School Framework, that's really that first box there is a place, if you click on that, that will give you all the up-to-date school guidance by different sections and safety measures for schools. And then, of course, the second box is testing, which may not be as relevant for this group, but it's just something interesting if you're, want to find out more about the different testing options and strategies. And then the third box here is frequently asked questions, and that is updated regularly, along with if there's any new guidance, the school guidance policy is updated on a regular basis, and it will show, if you can see it in the white under that little black bar there, there's updated and it has a date, so you check it regularly. And right below that is a dashboard. Every school, public, private, charter, is legislatively mandated to submit their school plan and also submit data every 2 weeks, letting the state know their reopening status and other opportunities that they're providing for that school or school district. So if you go to the next slide. One more slide. There we go. Okay, this is just giving you a little bit more feel for this K12 school guidance, which is, again, probably the most relevant for all of you, and just a little snapshot of what you can see. You can scroll down, you can click down to the various sections and learn about ventilation, masking. A lot of this, they have hyperlinks to other CDPH guidance. And if you could put, Judy, in the chat, all CDPH school guidance that is anywhere, any relation to students and staff, there's another CDPH page which basically will list every single CDPH guidance related to CDPH, masks, quarantining, vaccination. You can just click on the education box in that and it will list every single guidance, and that is updated, obviously, when things are changed. So if you go to the next slide, please. And one important thing that I think will be really helpful for all of you to see is that part of the COVID team, part of what was designed was to make sure that the local health departments were involved. They are trained. Every single local health department has a school liaison, a school specialist or school specialist team. And if you click on, and we'll put that in the chat as well, online, you will find the school specialist team or individual for your local health department. That person or team has direct contact with each school's school liaison. And every single school that is open has a school liaison. And that could possibly be like the Cal OSHA representative or a nurse or somebody else that is trained and understands all of the policies, and especially what to do when there's an outbreak, when there are symptoms, and what do you do with a student or staff if they're showing signs. So if you have any questions about what your local health department or your local school is doing with COVID-19 efforts, you can click on that link and you can find your representative right there. Okay, and next slide, please. The last slide, this is at the very bottom of the School Hub. This is just a great way to find things very, very easily if you're looking for, even for instance, to the top right, PPE. Where do you get more PPE? How do you go about getting more face masks, for example? Contact tracing. So these are just, you can click on these and it will give you some really good information that will hopefully help answer your questions. Next slide. And I said in the very beginning, we also have a parent page. If you go to the School Hub, the main page is typically for school administrators. However, really anybody can read it. At the very top right, there is a parent page that was just launched a couple months ago. And the purpose for this was really helping parents understand what schools and the state and your local health department is doing to get schools open safely, what are all the safety measures, and also the science behind why it is safe to go back to school. Frequently asked questions. And what's so great about this extra page is that it is in English and in Spanish. And I think that's it. If you want to go to the next slide, I'm definitely open to answering any questions. Definitely feel free to go to the School Hub and check it out. I'd be happy to answer questions at the end, or please feel free to email me. I am no longer with the school's COVID team. However, I'm still with Department of Public Health and works with the various teams that are still working on this, and I can definitely try and get any questions answered for all of you. So thank you very much, and I appreciate being asked to present today. Thanks, Victoria.
Oh, thank you so much, Janine. That was great. I feel like we, there's so much information within the hub, but I think you did a great job in terms of just distilling down what's in there for safe routes to school providers and those of us that might be doing school-based instruction in the coming year. I think the big takeaway for me is always making sure that with regard to COVID, we're passing along scientifically sound information, and so this is just a great site to use. And so I really appreciate your taking your time. I know you've been so busy with COVID response and your own your other work, so I'm grateful that you're able to share this with our network. And thank you for staying around for any questions at the end of our presentations. Okay, on that note, I'm going to, we're going to shift gears again, give one more perspective on safety from our wonderful speaker, who I've just become familiar with, but she is an excellent presenter. We're so grateful for her work. She's going to share on the role of law enforcement in pedestrian and bicycle safety. Just a little bit about Sarah. Sarah joined the University of North Carolina, UNC, Highway Safety Research Center in 2018. She's over 10 years of experience in non-motorized planning, education, policy design, and research. Her primary focus is conducting research and providing technical assistance to practitioners to improve walking and bicycling within communities. She's also a certified National Highway Institute instructor who's led the development of the North Carolina's Department of Transportation's Let's Go and See curriculum. And then really relevant to this webinar, she helped develop a basic law enforcement training module to teach officers about North Carolina's laws and enforcement strategies to reduce non-motorized travel risks. So let's get Sarah's slide on here for everyone. And
yep, and while we're doing that, we do have a quick poll. Victoria, if you want to introduce the poll, I'm going to open those poll questions for us.
Perfect, yes. And then, yeah, let's do this. This is a way for us to engage, again, who's on the call, since our Safe Routes to, our Active Transportation Resource Center network is so diverse. We know we have folks that are coming from all different disciplines. We just wanted to gauge if you are, if you represent a law enforcement agency, or if you're currently working in partnership with a law enforcement program for on your Safe Routes to School or Active Transportation program. I think what we'll do is just give that, those should be relatively easy questions to answer, so maybe we won't take as much time. But in the meantime, Sarah, can I just do a quick audio check with you?
I'm here. Can you hear me?
Yeah, you sound great.
Okay.
All right, and Judy, should we close the poll?
Yeah, we can do that. Give me just a second.
Yeah. And never want to like force people to participate, but these poll questions really do give us a nice sense of who's joining us so that we can just process that information as part of, our debriefing for these webinars, to figure out if we're really engaging, the diverse stakeholder network that we aim to do. So
There we go.
yeah.
Thank
Okay.
you.
So I'm seeing, Sarah, just from the results, just to give us some framing, we have 0% law enforcement representation on this particular call, but we do have a lot that's working in partnership. So we've got, yes, for not more than half, but we've got about 40% that are working with law enforcement. So this is, I think, really going to be a nice opportunity for everyone to hear about your idea book and all of the good work that's happening at the national level through your Highway Safety Research Center. So I'll mute my phone now, or sorry, my computer now, and let you take it away.
Sure, yeah. Thanks for the introduction, Victoria, and definitely thank you for the poll. That actually helps me understand who I'm talking to, and it's interesting to know that there's no one from law enforcement in the audience. That's okay, but you might be wondering about the role of law enforcement in pedestrian and bicycle safety, particularly when it comes to student safety. And some of you may be aware of national programs like the Safe Routes Partnership, who relatively recently deliberately moved away from the enforcement E in light of very valid concerns around social justice and equity, and the research that has shown bias in traffic stops and policing, also of people walking and bicycling. So, why are we talking about the role of law enforcement? Well, there's many ways that law enforcement officers can be involved in supporting safety beyond using the authority to actually enforce the law. And although some local communities are revisiting what role police may serve within their communities, by and large, they're still currently, serving as first responders to crashes and are responsible for investigating and reporting these events. They're also out and about in neighborhoods, and they see the trouble spots, and they have relationships and can work to build new ones within the communities that they serve, which can benefit outreach efforts for programs that you might be, have going on that are focused on bicycle and pedestrian safety. So I'll be touching on some of these aspects as I share with you insights that are discussed in an idea book. You can see the image of the cover there, that Kristen Blank, Laura Santz, and I authored for the National Highway Traffic Safety Administration. And this book gives examples and case studies from across the country. For today, I'm primarily going to share the ones that I'm personally more familiar with, that's through the work that I've done in North Carolina. The first point I'd like to make is that it is important for officers to get trained on bicycle and pedestrian safety. Basic law enforcement training typically doesn't cover bike and ped laws or issues. And of the training that they receive around motor vehicle law and crash investigation, it's typically focused on motor vehicle interactions and crashes. And they may get just a very little touch of bike and ped information. So before officers aid in communicating with others, they really need to be familiar with these sometimes nuanced and complex laws. And this can also help them overcome any reluctance to address safety issues, and it gives them a bit of the why it matters context. So because officers may not even be aware that bike and ped crashes and fatalities are overrepresented in certain communities. They certainly are in North Carolina. It's important that officers are equipped with that right language when they're interacting with the public, communicating correct practices and educating effectively. So understanding common crash scenarios can also ensure that officers are better prepared to investigate and report on a crash, apply the law, and work with others to prevent future crashes. The Watch for Me NC program is a program that aims to reduce pedestrian and bicycle injuries and deaths through a comprehensive, targeted approach of public education, community engagement, and leveraging specific law enforcement efforts. And one of the main arms of this program is to provide training, tools, materials, and resources to local law enforcement agencies in North Carolina so that they are equipped with this knowledge. And we really prioritize building diverse partnerships at the local level, which are needed to address the complex issues around bicyclist and pedestrian safety. And we recognize that law enforcement has a role to play in injury prevention. So here's a list of the trainings that we currently offer through the Watch For Me program. And this past year, we actually reorganized the training and opened up these modules, which had previously targeted law enforcement officers only, to allow all stakeholders within Watch For Me communities multiple opportunities for them to participate and bolster their knowledge. For officers specifically, they are required to attend either Module 2 or 3, which covers the laws, as well as 2 additional modules of their choosing. And then from there, they're eligible for certain resources, certain additional resources and physical tangible materials that they can use in their engagement and outreach. The second recommendation is to ensure that officers know the data, not only from crash reports, but other sources that can help provide a richer context or, filling in those blanks. So this is fundamental for any community really to understand what the issues or problems are that need to be addressed. Crash trends and patterns, they can help a community see where hotspots might be located or which types of behaviors are contributing to crashes. But you should be skeptical. Don't take everything with as is. Have a grain of salt in there, and don't rely solely on what the crash data reveal. And the reason for that is because bike and ped crash data or crashes are often unreported or underreported. And you need to be aware that there could be bias that's inherent in any data collection. So for officers, it's really important to stress that they're collecting accurate and objective, detailed information when they're writing up crash reports that include a bicyclist or a pedestrian. And more broadly, though, you can consider other partners, maybe even some of you, might have other sources of data that could be complementary to the crash data. So for example, hospital records. In North Carolina, bicyclist or pedestrian falls that don't include an interaction with a motor vehicle don't get collected through the DMV 349 reports, which means they're not going to be in a crash data set. So how else can you get that information? If the injury is bad enough, then perhaps hospital records. Or you could also look at complaints or community input for where maybe physical hazards have been noted, such as sidewalk that's heaving or broken, or potholes that might be in roads. There could be other physical features that might cause a pedestrian or bicyclist to fall, or maybe maneuver in a way that a motor vehicle, a person driving a car might not expect. So then, visualizing these many sources of data spatially, overlaying crash locations with infrastructure data, speed limits, other roadway characteristics, even land uses like schools or parks, communities can begin to prioritize where improvements are needed or where officers might be needed to assist, maybe as crossing guards or for traffic control or other duties that they can implement. So I do want to say, though, that ultimately achieving transformative change when we're talking about bicyclist and pedestrian safety, we really need to push beyond the reaction to the problem or set of events like a crash and move below the surface. So we need to think more deeply about what causes crash events and explore those underlying structures and beliefs and values that have informed the patterns and trends that we see. So crash data alone isn't going to get us that full picture, and enforcement alone is never going to be an adequate solution. So we need to recognize and acknowledge that many crash hotspots may be a reflection of the long history of valuing cars and drivers' convenience of moving through our cities over people walking or bicycling within them. And we can see this based on a couple quick examples here. You know, the evolution of transportation and land use planning that's depicted by the image on the left of a freeway kind of carving straight through downtown Atlanta. And then, you know, how the development and regulation of vehicles has evolved over time, primarily to the safety benefit of the occupant of the vehicle and at the detriment of anyone or anything outside the vehicle. We also need to understand that not everyone chooses to drive and not everyone has access to a motor vehicle. So obviously children, older people who may no longer be able to drive, or, you know, a person with a disability, someone who can't afford a car. All these are folks who are at a disadvantage in our existing transportation network, which is depicted by the image here showing, you know, no pedestrian sidewalk or facility, a transit stop that seems to be kind of just a sign in the middle of nowhere, and then a school, which is clearly a location where you would expect, you know, people might be wanting to walk or bike to. And these are just a few examples that show inequities within the transportation system in relation to people walking and bicycling. It's important to think about and acknowledge that responsibility for road safety is not equally shared. So for instance, research shows that people of color are disproportionately represented in fatal crashes involving people walking. And this example of disparity falls along race and ethnicity as shown in the slide. But, you know, you can also see it related to gender, age, disability status, and income. And much of this is a legacy impact of where high-speed streets have been located, and where there has been a lack of investment in infrastructure. So it's important to share those thoughts on equity before we go further, because it offers context about the road safety system and persisting inequities that are within the system, including the justice system. So when we think about state laws, they're developed around people walking and bicycling, or how they were developed around people walking and bicycling. We also need to consider thinking about those inequities, you know, thinking about when and how those laws were enacted, who they've been applied to, and how they've been applied. So law enforcement officers can play a critical role in reducing injuries and deaths of vulnerable road users. And this role can be most effective when we focus on those underlying issues, like I mentioned. At its root, the purpose of law enforcement is to maintain public order and public safety. So, you know, laws do help us define and maintain this social contract in which people can interact with one another, you know, based on these agreed upon rules and standards and protections. And the role of law enforcement, the role of enforcement, not just law enforcement, but enforcement can be broad, and it can range from prevention of violations to detecting and investigating crimes to apprehending and detaining people who violate that law or that social contract. And many folks, maybe even some of you on the phone that are involved in public health, certainly recognize the saying, an ounce of prevention is better than a pound of cure. And often focusing on prevention is more cost effective too. So in the case of pedestrian and bicyclist safety, conducting those activities that focus on preventing the violations and improving voluntary compliance with the laws and reinforcing behaviors that support that norm and culture of safety that we want to build, that's inclusive of people who walk and bike, that's where it's going to be more effective in reducing the number of and severity of crashes. And so for this reason, when we focus on the role of law enforcement, we really look to education, communication, and then detection and deterrence. And then I've already kind of touched on this, but it's also important to recognize that people's behaviors when they're traveling within the public rights of way are strongly influenced by their environment. So when we think about the land use around them, the roadway characteristics, you know, whether or not there are sidewalks or bike lanes or places for people, you know, to walk or bike, even observing other people's behaviors in those environments all give visual and contextual clues for how we should navigate that space. And so, improvements in voluntary compliance with the laws really ultimately call for changes in the roadway design and providing what's known as a self-enforcing road. So it's really important to get to know your engineers and public works folks, and engage with your planning department, advocate for that longer term intervention that needs to happen to create those environments, and then officers will be more successful in the enforcement endeavors that they take on. So because of the fact that pedestrian and bicyclist safety is a socially and organizationally complex issue, law enforcement really need to collaborate with these other partners. And we talk about ways that partners can be helpful in a lot of different ways. They can bring in different perspectives, they have different experiences, but they can also bring in different tools and resources and even connections and context that they have into the mix. And this is true when you think about the microcosm of a school and its setting in the school's community. So here's an example, and the screen probably looks pretty chaotic. And it's intentionally that way to show the complexity of some of these underlying factors that might influence a behavior like driver yielding within a community. Often we think the role of enforcement here, we snap to, well, we just need to make sure that the drivers know the law, or, officers need to ticket drivers who don't yield to pedestrians in a crosswalk. But here we can see that there are many other interconnected issues that may actually help reveal that the root problem at a given location might actually be the roadway design, speeds approaching the crosswalk, those vehicle speeds, or it could be at a location where drivers can't see pedestrians or they don't expect people to cross. And this doesn't even touch on all the different factors that might influence a driver's decision to yield. So when we think about who needs to be in the room with us to help solve these issues and avoid those unintended consequences, you begin to see this value of having a broad coalition. So one great example that we have in North Carolina of a really well-functioning coalition is Greenville's Traffic Safety Task Force. This is a task force that's comprised of members of the local police department, East Carolina University Police Department, and Vidant Medical Center, which is a regional medical care provider in the region, and they have an injury prevention manager. And then they also have the city's traffic engineering department, a public information officer, and then even at the state level, a representative from North Carolina Department of Transportation's regional division office, as well as a representative from the Metropolitan Planning Organization. So lots of different stakeholders are coming to the table. They meet, I think, monthly. And the reason they started this is because the city was ranked #1 in North Carolina for crashes, all crashes, not just bike and ped crashes. And they've been working to turn that around. And with the most recent crash data, they've now been able to show that they've moved the city down to being ranked #5 in crashes. So they're definitely making progress. And over the years, the task force has gathered some lessons learned for what's made them effective. And definitely understanding that collaboration moves at the speed of trust. So they really had to build up those partnerships across the stakeholders. They do meet regularly and in person if possible. Of course, that's been more difficult with COVID. And they have specific roles and actions that each entity or representative takes, and they have follow-up on those commitments so that there's accountability. They started small, they identified, one type of activity that they could work on, and then they grow with their successes that they celebrate and share over the years. They did have a caution about being prepared for turnover and transitions. And so that's another reason why it's been important for them to document their shared vision and goals, as well as the action items that they are in the process of implementing, so that when a new representative comes in for a particular agency or entity, they can handle that, and they know right where to pick up. From the Watch for Me program more broadly, we have also seen many communities that commonly have ties with these key potential partners that are listed here. Communities that are focused on student safety, of course, it would be critical to get buy-in and build relationships, not only with the school system, but with principals or PTA representatives, other champions within the specific schools of interest. And you'll also see that question mark, excuse me, down in the bottom, that serves as a fill in the blank. And it's really based on an individual's, an individual community's values and the goals that they might be setting for their safety initiatives. So in some cases, you know, they'll have advocacy groups or bike groups coming in. Safe Kids is pretty popular. Representation from the health departments or healthcare centers or injury prevention groups is certainly key. And then there may be large employers or businesses in the area, or even chambers of commerce that can get bought into it and value bicyclist and pedestrian safety and want to be a part of the solution. And then, of course, you know, key neighborhood groups and community centers or faith-based organizations can certainly be an important partner as well. And, you know, law enforcement can and should have relationships with each of these partners. So that's important to emphasize as well. So officers can play a key role in engaging with the community. And when I say engagement, you know, recognize that this is a dialogue of giving information or educating the public, but also receiving information and feedback from the public. So engagement opportunities are an excellent way to, you know, gather those complaint records that I mentioned earlier. And sometimes you do just need to push out a message. So that's important to remember as well. But in fact, effective engagement is can be utilized by identifying important influencers within a community. So this might be, you know, community leaders or activists, or maybe even public officials or representatives. Key gatekeepers, and examples of that might be like fleet vehicle operators, or maybe crossing guard training managers if you have crossing guard programs. And then bridges to key populations. And what we mean by that is thinking about folks like maybe pastors or barbers or other people that are you know, important to a key population that you're trying to target and reach out to. And you need to bring those folks into the discussion because they can help you with the broader outreach. And ultimately, effective engagement does require meeting people where they are. So that's really, really important to think about when you're setting up some sort of engagement or public involvement process. So I've listed a few examples here on the slide, but I'm just going to share a quick story about the first one, which is the Outer Banks of North Carolina. And it swells with a tourist population in the summer. It is on the coast. And the region participates in the State Department's J-1 visa program, where international students get work visas to come over for the summer, and they work while they're exchanging cultures. Many of these students come from countries with very different social and cultural norms from North Carolina around bicycling and walking. And they often don't have personal vehicles while they're here because they're just here for like, you know, 2-3 months. And they typically walk or bike to get to or from their jobs because the Outer Banks does not have a very good transit system. And they're often working in retail or hospitality sector type jobs. So the local Watch for Me NC program provides safety information on the laws, and equipment like the retroreflective bags that you can see there, and bike lights to the student workers as part of their orientation. So when they first arrive, they're getting that information to prepare them better on how to travel safely within this new area for them. And student safety programs, you know, school resource officers or crossing guards can be two unique positions where law enforcement officers may directly interact with and support bike and ped safety around schools. So those are that kind of gatekeeper position that I mentioned that can serve to reach specific student populations. And they can really help with building partnerships within the schools and school systems and help to implement specific educational and outreach programming that you might want to do. One such program we have in North Carolina that officers can use in their role as an educator is the Let's Go and See curriculum. And this is a pedestrian and bicycle safety skills program that offers grade-based curriculum package. And it includes lesson plans, videos, worksheets, skill building activities, and an instructor guide. It's kind of all packaged together. And it can help officers or really anyone in the community that wants to teach kindergartners through fifth graders on how to walk and bicycle safely near traffic. Now, you might also be familiar with bike rodeos, and that's another excellent type of event that law enforcement officers could be involved in. And they are great at attracting interest and raising awareness, but it's important to note that one-time rodeo types of events really can't take the place of some sort of multi-day skills-based programming with more practice time, which ultimately is what people need so that they can build those safe habits, especially if they're new to bicycling. Driver education courses are another way that officers can get involved as a guest speaker or a lecturer, focused on emphasizing the privilege and the responsibility that drivers have when they're operating a vehicle and how to do so safely around people that are walking or bicycling. And then finally, once officers better understand the issues impacting the safety of people walking and bicycling, then conducting a high visibility enforcement operation might be an effective tool for deterrence. And this could target speeding or driver yielding or some other key behavior that's been identified for a targeted enforcement effort. I'm primarily going to talk about pedestrian crosswalk operations, which target driver yielding behavior, but I'll also mention a couple of others. So in North Carolina, the purpose of this type of operation, at its heart, it's still fundamentally an educational tool. And when you do it well, it not only identifies and stops the violators, but you also amplify to the broader public that your community values pedestrian safety, and it reinforces the expected norm is for drivers to yield to people in crosswalks. So a well-planned operation is going to lead to the public's better understanding and compliance of those laws. And we do that by harnessing the media to notify the public that an operation is going to take place before it happens, and then covering the operation during the time, and then sharing feedback on those results from the operation. So the media can help amplify that message. Agencies can also set up operations to target bicyclists that may not be well equipped to ride. So for example, distributing helmets to children who are observed riding without one, or securing bike lights on the bikes of people riding under dark conditions. So in both situations, providing the safety equipment to the violator, it not only aids them in becoming compliant with the law, but it affords that teachable moment for the officer. So they can have a positive interaction with a person in the community while explaining why the equipment is important to use beyond just that it's the law. And North Carolina DOT has a bicycle helmet initiative that can aid communities in distributing helmets to underprivileged children. And then through the Watch For Me community, through the Watch For Me program, partner communities are provided with bike light sets that the officers can use to distribute in lieu of citations. Another twist on traditional enforcement operations can be to target people who are following the law instead of targeting the violators. And we call this a caught being good kind of operation. And they work best when a local business partners with your program, and they can help sponsor the reward. So A reward might be a gift certificate for coffee or ice cream, some other kind of small treat. Some typical pedestrian or bicyclist behaviors that might be rewarded are, crossing at a crosswalk, obeying traffic signs and signals, or wearing a helmet or using a bike light. And this positive reinforcement activity rewards and encourages good behavior. And again, to be most effective, it's really important to involve the media to get coverage of that type of operation as a way to broaden the reach of your message. So with that, I'm going to share a quick resource with you that covers a broad array of topics around bicycle and pedestrian safety. And that's the Pedestrian and Bicycle Information Center, or PBIC. And some of the topics, there's a whole range, but some of the topics that might be of particular relevance to you guys include information on driver training programs, health, passing laws and yielding laws and enforcement, and then youth safety and mobility. And you can find loads more resources under each of the topics, as well as webinars from experts on the subject matter. You can also join the PBIC Messenger, which is shown in the image on the left. That's a newsletter that we issue, and it can help you stay up to date on any upcoming webinars or new resources as they're produced. So with that, I am open for questions, and I will turn it back over to Victoria.
Thank you so much, Sarah. That was wonderful and just so much good information. I appreciate you really laying out how a process for law enforcement to reconsider their roles, or refine the roles if in fact they're doing kind of what you've already laid out. So wonderful presentation. Just to keep us going, we have about 15 minutes. And usually at this point in time, we have our question and answer section. So I want to apologize. I had sent out a link, or not a link, a message to everyone. We really want to make sure that if you're chatting, that you put your questions to everyone. In WebEx, there's actually an opportunity to do all attendees, but that's not what you want to do. You want to chat to everyone. And you can see right now, Judy's been putting chats in the links in the chat so that that you can consider some of the resources that have already been shared. But at this point, if you've got questions for any of our presenters, Elena, Janine, or Sarah, I encourage you to put your questions into the chat box now. And then Elena, Janine, and Sarah, if you could do me the pleasure of having your lines or your audio unmuted so that we can do a ping pong with these questions that are coming in, that'd be great. So just want to make sure that I can hear you all. Elena, you still with us? And Janine?
I'm here.
Okay, great.
Yeah, I'm here.
And Sarah. Okay, perfect. Okay. All right, let's, I appreciate one of our panelists actually had a question for one of our other panelists. So this is the first one. This is for Janine. So does the that's a habit. Does the Safe Schools for All hub include transportation related information at this point in time? In North Carolina, we're seeing many more caregivers driving to school to avoid taking the bus. This causes further congestion. Has there been any discussion on shifting those trips to walking and bicycling as another safe way for physical distancing?
Yeah, I think that's a great question. I wish I had a better response to that, other than I know that Department of Education, at least for California, addresses transportation, specifically school buses, on their website as part of sort of their back to school policies. There's a federal law that, they have to wear masks on buses, and they should space out, but that's it in terms of that. I don't know, and I hope that schools have addressed the better options and safer options to walking and biking to school. But I don't have an answer for you at this time, but I can certainly try and find out more from the Department of Education or Victoria.
Great. Well, I actually appreciate that. And I think what maybe I'm one of the follow-ups to Sarah's question is maybe we can, as a network, figure out ways that we can support the Safe Schools for All hub so that there's more transportation related information, to encourage COVID safe travels, but also reinforce the idea that, walking and bicycling is great for health. It's great for boosting immunity, great for social cohesion, and being outdoors is certainly, much safer, comes with less risk in terms of COVID spread. So thank you, Sarah. I love that you're giving technical assistance to the technical assistance providers at the state.
Well, and to add on to that also, one thing where I think we've kind of reversed and because of COVID is the fact that people aren't carpooling as much, and there's more cars out there because they don't want to pick up two, three kids to drive them to school because they're at the risk of giving each other COVID. So definitely, I think that that's something that is probably part of the movement that, another great way to then try and enforce walking and biking instead of more cars on the road because they don't want to carpool.
Yeah, I think I think with a lot of this work, I think we want to be able to build trust, and not, re-traumatize already traumatized networks. So, but I think our network is probably willing and ready to nudge, the schools hub and all the partners there to consider mobility needs as well, that have health co-benefits. So, but yeah, that's clearly an area we can follow up. I'm going to encourage folks to ask questions through the chat, but I wanted to actually circle back to Elena's presentation and maybe just have you speak to some protective factors. And I want to couch my question. So, I think one of the reasons that I know a number of my colleagues and I are so committed and so passionate about active transportation is that it really is about it has so many health benefits, so all the chronic disease benefits, but also increasingly more and more psychological health benefits, just being able to get outdoors, get moving, kind of get away from, a cycle of negative thinking. So when you talk about toxic stress and how that can be mitigated with protective factors, is there anything that you can share, this is a loaded question, about the physical activity connection as a protective factor, or is that something that your networks are discussing at this point, or is that maybe an area for additional exploration?
No, that's a great question. Thanks, Victoria. So yes, there is a work product that's underway. It's in the form of a policy platform. And essentially, this piece is about to come out for comment and review. It lists, we had held 12 work groups on naming and raising up evidence-based and evidence-informed policy strategies that improve the lives of children and families in California. And there are a pretty hefty subset that involve looking to active transportation principles, perhaps, or policy efforts that in order to improve resiliency and mitigate toxic stress. So some that come to mind include safe routes to school, policy strategies that support being active, a variety of things like bike kitchens, or strategies that think about skate parks and things like that, and then greening of spaces, a lot of those strategies are either maybe something that comes through in the form of a general plan effort and thinking about those types of products, or in communities, or thinking about voluntary or legislative policy strategies. So I do think that there's been some great efforts in not only naming the policies, but themselves, but also they have spent some time identifying samples and model policies that they think are worthwhile to lift up. And so there are links found within this piece that have been scored by a special work group. And then our data subcommittee identified some base indicators that would support a person working at the local level who was considering taking something on or needing to explain to a decision maker or policy maker about why their strategy is worthwhile. So yes, the answer is yes, and the answer is we need reviewers. So we anticipate that this will be coming out in the next week or so, and so we would greatly benefit from the wisdom of active transportation folks to weigh in and share with us, if we're on the right track or if there's adjustments that y'all would make. Yeah.
Fantastic. We have a wonderful network within the state of a lot of just wonderful, brilliant minds that I think our team would be willing to assist with the reviews, but we can also kind of look beyond our department because there's certainly a lot of expertise at the local and regional level in our state counterparts that are working on advocacy. So that is very exciting to hear. Can I just ask one more follow-up question of Elena, and then let me do that first, and then I'm going to ask my colleagues if I'm somehow not seeing questions coming in. But Elena, can you speak to the 80 different programs and organizations that comprise the Essentials? How are they laid out through the state? So I guess what I'm asking is, if local active transportation networks or Safe Routes to School practitioners want to get engaged, want to do some local level collaboration with Essentials, folks that are really more skilled in trauma informed approaches and healing centered work. What's the way that we can instruct from the state level how to engage at the local level?
Yeah, okay, that's a good question. So the folks that are engaged in Essentials are folks from state government, local government, nonprofits across the state that are working locally, or those that are working statewide, and then philanthropic organizations as well. So there are a few projects where, if you were seeking to get engaged at the local level, we have a partnership with All Children Thrive California, who was just reauthorized by the state legislature for 5 more additional years of work. And their intention is to be supporting coalitions up to 50, I believe, is the number that I think I most recently heard. And there also we have teammates who are working on county prevention teams through child welfare, through the Department of Social Services. And so we're seeking opportunities currently to better flesh out this relationship and where there might be opportunities for collaboration and engagement. So that's kind of a little bit more to come. But another concept or thought is that the Essentials for Childhood Initiative created a coalition e-guide, and it lists, I think we're at around 200 local coalitions who are working on issues that improve child well-being in California, and it's sorted by county. And so I'll drop a link in chat to that, but that would be my recommendation for how to get involved on, and be collaborative with folks at the local level who, have synergy and overlap and interest in the work of active transportation. So give me just a second, I'll drop it in.
Yeah, perfect. Thank you so much. I think that, I think Sarah might be able to chime in with with this, that, you know, I think the partnerships piece is critical. You know, we can explore some connections because they kind of make sense, but I think, you know, recognizing that there's some higher risk groups for transportation related crashes. You know, there's environmental design, but there's also, you know, maybe there's just more things happening, you know, that a person is experiencing, and so I think there's just, and it's not clear to me yet, but I think that there's just levels of collaboration that can lead to connection and support for a whole person that, you know, I think are, at least from my vantage point, we have yet to really explore the state level. So love this. And then I will encourage anyone who's listening to, you know, comment in if you're actually engaged already in this work, if you can, you know, share that with us through the chat. That would be interesting to note. Definitely something that we would love to hear about.
Yeah, so this is Sarah. I'm just going to kind of add on to that. And it kind of gets back to Elena's tree that she showed, where some things you can see, you know, on the surface, but then there may be other things going on underneath. And that kind of relates to the iceberg that I showed. But a very direct example of that was we were working with the city of Wilmington, North Carolina, when they were a new Watch for Me community, and we were talking about, you know, well, what do you see as some of the problem locations or problem areas or behaviors in your community? And initially they were saying, you know, well, we've got a lot of there's an area where there's a lot of people who just, you know, they cross mid-block, they don't go down to the traffic signals and cross at the crosswalks. And we started looking at these locations on the map, and one place in particular, it was, you know, a 45-mile-an-hour, you know, multi-lane kind of facility where the traffic signals are kind of stretched out far from each other. You know, it's kind of your typical, you know, suburban type corridor. And they were saying there's a homeless population that was often the people who were crossing mid-block there. And we started talking more about it, and it turns out that there were two different social services that the people who were unhoused needed to be able to access, that were on either side of the street. So, you know, again, you know, they saw the initial problem as being, well, we just need to figure out a way to get these people to stop crossing mid-block. But it turned out that the underlying issue really was, how do we address homelessness? You know, like this is part of a bigger picture problem that maybe wasn't something that they initially thought they'd be talking about when they're talking about active transportation or improving things for bicyclists and pedestrians. So yeah, there's definitely a lot of interconnectedness to
I agree. I'm just thinking about Elena's 4 R's, and the last one being resisting re-traumatization. And there's such a crosswalk between the work that you've introduced and reinforced today, Sarah, in your presentation, and the language that is, you know, central to the trauma-informed approach. So I really appreciate all of our presenters. I'm looking at our clock and seeing that we're kind of nearing the 11 o'clock. So I actually am going to move forward. And I apologize if we're not, you know, if I'm not seeing your questions in the chat, but, you know, I know that this is a lot of information to process, and we can certainly revisit based on any feedback that you guys give to us. We'll solicit it as we do our outreach to our network. But let's wind up, shift gears, and I just want to make some announcements about some upcoming opportunities, also through the active transportation. Oh, and I must realize that yes, this is not our 4th and final webinar. Next one is we've got a non-infrastructure related funding opportunities webinar coming up next month. That's October 19th. It'll be in the morning. And the webinar is going to focus on exploring different funding programs for active transportation plans, as well as for pedestrian and bicycle safety, education enforcement engagement, probably some pre-engineering work as well. And then there's also going to be a nice speaker who's going to talk about his work at the local level in terms of leveraging all of these disparate funding sources. Next slide, please. And this is a big one we want to promote, our California's 2021 Active Transportation Symposium. It's going to go over 3 days. It's a virtual symposium covering 3 mornings, starting at 8:30 to 12:30 p.m. Next slide, please. And just so you know, the goals of our symposium, it's the 2nd annual one, and what we're doing is bringing together active transportation stakeholders from throughout California to share information on relevant active transportation topics. And we're going to speak a lot about implementable solutions. So the registration for both the funding webinar and the symposium are on our active transportation resource website. And as we communicate after this, we close out this webinar, we'll make sure that you have a direct link to both registrations. Next slide, please. Just as a reminder, the CDPH Active Transportation Resource Center non-infrastructure focused technical assistance team is comprised of Judy, Marianne, and myself. We are assigned to different Caltrans districts so that we can do some more longer term relationship building and coaching with you with our awarded network. If you so you know, we're reaching out to you guys this month and next month in a concerted effort, but if you want to reach us sooner than later, here is our contact information. We're all still working remotely, so email is definitely the best at this point in time. And last slide. Oh, just a reminder, please do our Alchemar survey when we're closing out. We'll also send this in the post-webinar follow-up. And then finally, a big thank you. I want to thank Elena Costa, Janine Barbado, and Sarah O'Brien for your wonderful presentations. And on behalf of the Active Transportation Resource Center, I want to thank everyone for attending our webinar today. Thank you and stay healthy, California.